You know that feeling, right? It is one of the most frustrating things in the world. You've got this pain, maybe it's your back, your shoulder, your knee, and all you want to know is why. What is actually going on in there? Well, today, we're going to tackle that exact question and pull back the curtain on medical imaging.
So let's just get right into it. If you have ever had that nagging low back pain, I'm pretty sure this question has crossed your mind. You're probably thinking, if I could just get an MRI, I'd see the problem, and then we could just fix it. But is it really that simple?
And that really gets us to what I like to call the MRI quick fix myth. It's this belief that a super high-tech scan is always the first and the best step to feeling better.
And look, it makes total sense, right? You're hurting, an MRI feels like it's the key that's going to unlock the whole mystery, to finally see what's causing all the trouble. It feels like the most logical, most direct path to an answer. But then, you go to the doctor, you're ready for answers, and you hear those two little words, "not yet." And that can be really confusing, maybe even a little frustrating. I mean, why would they want to wait? Well, to get that, we first need to understand what these scans are actually doing.
All right, so let's take a look at the technology itself. What really is the difference between an X-ray, a CT scan, and that MRI you were hoping for?
Okay, first up, the classic X-ray. You can think of this like a black and white photo of your skeleton. It's super fast, it's available pretty much everywhere, and it is fantastic for seeing dense stuff, like bones. So if you're looking for a fracture, this is your go-to, no question. Next, we've got the CT scan. Now imagine taking a whole bunch of X-rays from all these different angles, and then a computer digitally stacks them up to create these 3D slices of your body. It's way more detailed than a regular X-ray, and it can see bones and even some organs really clearly. The only trade-off? It's a higher dose of radiation. And finally, the MRI. This is the big one. It's a total game changer because it uses zero radiation. Instead, it uses these incredibly powerful magnets to give us a stunningly detailed look at all the soft tissues, the stuff that X-rays just can't see, like muscles, nerves, and of course, those infamous spinal discs. So this table really breaks it down perfectly. X-rays are for bones, CTs give you those detailed cross-sections, and MRIs are the superstars for soft tissues. When you look at it this way, you can see exactly why an MRI seems like the perfect tool for back pain, which so often involves discs and nerves. So, that brings us right back to our big question.
Why on earth would a doctor tell you to wait for the one scan that seems perfectly designed for the job? Well, the reason is actually based on decades of scientific evidence.
And here's the crucial part. Major medical organizations, like the American College of Radiology, have really clear guidelines for what they call nonspecific low back pain, which basically means pain without any other alarming symptoms. They strongly recommend holding off on any imaging for the first 6 weeks. So, instead of jumping straight to a scan, the evidence points to a completely different path at first. It all starts with a thorough physical exam by your doctor. That's usually followed by conservative treatments, things like physical therapy, maybe some anti-inflammatories, and most importantly, just time. The truth is, the vast majority of back pain episodes get better all on their own with this approach.
But here's where it gets really interesting. This is the real twist, the biggest reason for waiting. Sometimes, the problem isn't that a scan sees too little, it's that it actually sees too much.
See, an MRI is so incredibly sensitive that it will almost certainly find something. So let's say it finds a disc bulge. Your first thought is going to be, aha, that's it. That's the smoking gun. That's what's been causing all my pain. But you might be wrong.
Because, and you've got to hear this, here's the mind-blowing statistic. More than half, let me say that again, more than half of all adults over the age of 40 who have absolutely zero back pain will have findings like disc bulges or degeneration on their MRI scans. Just let that sink in for a second. A lot of these things are just normal age-related changes. They're like gray hair or wrinkles, but on the inside.
And look, this isn't just some wacky theory. It's a well-documented medical fact. As the American College of Radiology themselves put it, these so-called abnormalities are often just incidental findings. They're there, sure, but they aren't actually causing the problem. They're basically just bystanders, not the culprits.
And that's the real danger here, because once you see that word bulge on a report, it is really hard to unsee it. It can create a huge amount of anxiety, and it can send you down this rabbit hole of more tests, more injections, and sometimes even surgeries that you never actually needed in the first place, all while you're chasing something that wasn't the real cause of your pain.
Now, I want to be super clear about this. This does not mean scans are useless. Far from it. There are absolutely times when getting an MRI right away is the right call. It can even be a life-saving decision. So let's talk about the exceptions to the rule, the red flags.
Doctors are specifically trained to look for these red flag symptoms. These are signs that your pain might be caused by something much more serious. We're talking about things like a personal history of cancer or what they call constitutional symptoms, like an unexplained fever or losing a lot of weight without trying. There are also signs of a serious injury, like pain after a major fall. And, most critically, there are neurological signs, like a sudden loss of bladder or bowel control, or a weakness or numbness in your legs that's getting progressively worse.
Yeah, if you have any of those symptoms, that whole let's wait and see approach goes right out the window. These are not the signs of a simple muscle strain. They point to potentially urgent problems like a spinal infection, a fracture, a tumor, or severe nerve compression that have to be seen and diagnosed immediately. In those cases, a scan isn't just helpful, it's absolutely essential.
And this just lays it all out perfectly. It's the two sides of the exact same coin. The very same test can be two completely different things depending on why you're using it. When it's used unnecessarily, it can cause a ton of anxiety and lead to treating normal aging. But when it's used for the right reasons, for those red flags, it's an incredibly powerful tool that leads to a clear diagnosis and life-changing treatment.
So what's the big takeaway from all this? Well, the goal isn't to walk into your doctor's office and demand every test under the sun. It's about partnering with your doctor, understanding the why behind their recommendations, and really becoming an informed participant in your own healthcare.
And that really leaves us with one final thought. We often think that more technology, more information is always better. But in medicine, the real goal isn't just about getting more tests. It's about getting the right test at the right time for the right reason. Something to think about. Thanks for tuning in.